Today is National Wear Red Day, the first Friday of February of every year that's set aside to urge women to unite in the fight against heart disease. Right now, we are joined by a very special guest, Dr. Stephen Anwar. Right? Dr. Stephen Anwar.
Thank you.
He's a cardiologist with SIH Prairie Heart Institute. Dr. Anwar, thank you so much for joining us. Can you tell us a little bit more about National Wear Red Day?
Yes, thank you very much for having me here on behalf of Prairie Heart and SIH. It's important to know that heart-related problems are a very major part of our general health and the leading cause of death in general, and also for women. 1 in 3 women will probably die from a heart-related problem. So because of that, it's an important way to remind ourselves of just how much attention we need to pay to this problem.
Very important. Can you tell us a few stats? Like, I know it's important, but what's the difference between men and women?
The main difference here is really in the way that women may sometimes present with heart-related problems. The second part to that is the type of treatment that they might receive. The third is that the type of what we call risk factors that they might have that will be different from men. And the fourth is that the outcome that we are looking for, the good outcomes that we are looking for in women tend to be different from what we get with men.
Right.
And it's usually less than optimal for men.
Can you tell me some symptoms that women should look out for?
Yes, by far the commonest symptom for heart disease in both men and women, particularly heart attacks, is chest pain. But there are the symptoms that women might present with. They might have what might feel like indigestion or acid-like problems. They might just have fatigue. They might have shortness of breath. Sometimes they might have pain in the left arm, in the back, in the neck, which are not the typical symptoms that we tend to see in men. But one needs to be alert to those symptoms because it could be the way they might experience a heart attack. And
so what should they do if they find themselves experiencing any of those?
If you experience these symptoms, the best thing to do is to seek medical attention, and preferably if one is not feeling well, they should try to get to the nearest emergency room by calling EMS.
Okay, so if women would like to know a little bit more about this day and just heart health period, what would you suggest for them?
I think the first thing is to know that your cardiovascular health begins with your general health. So you want to have healthy habits, which include eating, exercise, weight, things like tobacco and alcohol. All those will affect your general health, but they also specifically will affect one's cardiovascular health. So that's the beginning.
So really just common sense things about taking care of your body,
yes,
right?
For the most part, it's really just the very basic stuff. If you can exercise regularly, if you can eat healthy, if you can keep your weight down, if you can stay away from tobacco, and if you're going to drink, if you keep it at a minimum, you are really on the right path.
All right. Okay, thank you so much, Dr. Anwar. All right, we're going to toss it over to our chief meteorologist, J.C. Brienne.